السلام عليكم طلاب. نقدم اليوم محاضرة على ال Diseases of Liver and Biliary System ضمن مجموعة ال Liver and Biliary System. راح نقدم على الكحوليك liver disease. طبعا الكحوليك liver disease بيها هواية رينج من ال parts of diseases تبدي بالفاتي changes. ممكن يصير عندهم hepatitis with the zone 3 fibrosis اللي تؤدي إلى cirrhosis. وممكن يصير associated with the pancreatitis with the consequence of biliary structure. كذلك الهيباتوسيلر carcinoma. الانهانس hepatitis B and C who are already يعني infected with such viruses and also as a part of enzyme inducer which enhances the يعني causes drug toxicity. طبعا الكحول remain one of the most common cause of chronic liver diseases worldwide, especially in the Western country, and the risk of such disease is variable. And not everyone who drinks heavy alcohol will have the disease, usually have certain dosage and the duration should be associated with this to form this form of disease. In 15-20% of heavy alcohol drinkers will develop alcoholic cirrhosis. طبعا the average intake of alcohol in large group of male alcoholic cirrhotic patients is 160 gram per day for around 8 years. بالنسبة للalcoholic hepatitis in pre-cirrhotic lesions we noted in 40% of this will drink less than 160 per day, which means that even in much doses can lead to some sort of alcoholic diseases before will change to cirrhotic, and for most individuals the danger dose is greater than 80 gram per day of alcohol. طبعا نقطة جدا مهمة يا طلاب انه ال duration is very important من الدراسات وال studies شافت انه neither cirrhosis nor alcoholic hepatitis was seen in patients who consume an average of 160 gram of ethanol per day for less than 5 years. معناته duration at least more than 5 years حتى develop significant changes within the liver, whereas 50% of patients consume higher level of alcohol for an average of 21 years develop cirrhosis. طبعا الميل يختلف عن الفيميل. female أكثر عرضة للliver cirrhosis with a much lesser dose of alcohol أو ethanol. بالنسبة liver injury is unrelated to the type of beverages. It is related only to alcohol content. طبعا على سبيل المثال United States يعلقون على one standard drink contains roughly 14 grams of pure alcohol. يقدرون يحسبون ايش قد ال consumption of alcohol per week. which found in على سبيل المثال هو بالبير is about 12 ounces, which is about which have only 5% of alcohol, بينما ال 5 ounces of wine تحتوي على 12% of alcohol, which means that it depends on the type of alcohol has been consumed according to the percentage of it. مثل ما تلاحظون بهذا الدايجرام أنه الكحول has many pathways and pathogenesis to cause liver cirrhosis. واحدة منهم هو ال gut permeability يأثر عليه leading to endotoxin، وبالتالي هيحفز الكفر cells اللي هي موجودة بداخل liver leading to the production of tumor necrosis factor and اللي هو alpha interleukin 6 اللي هو يؤدي إلى inflammation. كذلك acetaldehyde بحد ذاته يؤثر على الليفر in the form of the adducts level with also the CYP2E1 هو the enzyme موجود بالليفر اللي بكل ما يزداد الأوكسيديف ستريس related to the alcohol راح يؤدي إلى lipid peroxidations and low glutathione. طبعا الجلوتاثيون بالمناسبة هو يسموه protector of the liver from the toxic material. اللي حد ما من يزيد الدوز ويزيد الفترة راح يقل الجلوتاثيون وبالتالي يؤدي إلى liver injury، خاصة إذا كان طبعا إذا كان patients عندهم genetic susceptibility to have liver changes or liver cirrhosis أو have already coexistent other liver diseases مثل hepatitis B أو C اللي هيكون أكثر عرضة to develop liver cirrhosis. Drinking pattern هو one of the important risk factors to develop chronic liver diseases, which means the type of the beverage drunk which is used. But the liver damage is more likely to occur in continuous rather than the binge drinkers. Gender بالمale is affected more, the female affected عفوا more than the male, with the consumption of less doses than those consumed by the male. In addition to the genetic factor, شافوا إنه some the people they have the genetic ability to have the gene coding enzymes specifically involved in alcoholic metabolism that lead to tumor necrosis factor protections and the aldehyde dehydrogenase, the aldehyde just highly and specifically linked to the alcoholic liver diseases. بالنسبة للetiology, الكحول is metabolized almost exclusively by the liver, and about 80% of alcohol is metabolized to acetaldehyde by the mitochondrial enzyme, which called the alcohol dehydrogenase. The acetaldehyde forms the form of adducts to with the cellular proteins and hepatocytes, which activate the immune system, leading to the injury. Acetaldehyde is then metabolized to acetyl-CoA and acetate by the alcoholic liver disease, and about 20% is metabolized by mixed function oxidase enzymes at the smooth endoplasmic reticulum. السيتوكروم CYP2E1 is induced by alcohol مثل ما ذكرنا بالدياجرام السابق، اللي هو حيزيد من الاكسجين increase oxygen consumption and lipid oxidation، وكذلك يأثر على level of the glutathione production, which is the main function is to protect the liver from the toxic effect of the acetaldehyde. طبعا الميكروسومال peroxidation leads to the oxygen free radicals، وهاي الفري radicals هي تأثر على mitochondrial damage, which leading to a specific injury to the patient with the use who consume the alcohol for a long period, and still this phenomena is poorly understood. And also there's the cytokines is blamed in the form of the injury in the form of endotoxin, which is released in the blood in alcoholic patients, leading to hepatitis via increasing the gut permeability. وهاي cytokines هي عديدة من عدة human growth factor alpha and the interleukin 1 and 2 and 8. Clinically, طبعا the patient's clinical liver disease manifests itself as a clinical spectrum ranging from the incidental normal liver biochemistry with a few physical signs to advanced cirrhosis. The liver is often enlarged in alcoholic liver disease even in the presence of cirrhosis، وهي واحدة من الأشياء المهمة جدا فرقها بين non alcoholic liver diseases. طبعا هنا أيضا الهيماتوكروماتوسيس حاب أذكر أنه ممكن also increase with the associated with the liver cirrhosis with the large liver. The peripheral stigmata of chronic liver diseases, including Dupuytren's contractures and palmarothemia, are more common in alcoholic cirrhosis than cirrhosis of other etiologies. لو نشوف هنا بالclinical syndrome of alcoholic disease هو ممكن presented as a fatty liver، وعادة هذا يكون asymptomatic discovered accidentally when he do investigations. ممكن يكون normal liver، ممكن يكون slightly large liver، لهذا يكون asymptomatic form، اللي هو هذا النوع اللي هو يعني need early detection in those patients عن طريق doing frequent follow up. وممكن يجي as the second presentation is alcoholic hepatitis, in which patients have jaundice and hepatomegaly, malnutrition, features of portal hypertension, ascites, encephalopathy in the form of acute hepatitis. وممكن يجي patients after a while of years in the form of cirrhosis with all features of stigmata of chronic liver disease, with ascites and esophageal varix, encephalopathy, large and normal small liver. ممكن يكون بهالحالة يعني ممكن يكون small liver ورا ما يكون cirrhotic ورا فترة طويلة جدا, and also it's highly associated with the hepatocellular carcinoma. طبعا investigations aim to establish alcohol misuses, exclude alternative or coexisting cause of liver disease such as hepatitis C and haemochromatosis, and assess the severity of the liver disease. Usually those patients who drunk alcohol may be coincidentally have infected by hepatitis C or hepatitis B, or may have other comorbidity like diabetes. All these should be investigated about or by taking history and other investigations. The clinical history from the patients with relatives and friends is very important, especially in those the alcohol misuse, and also we should insist on asking about the duration and the severity. Macrocytosis is one of the important finding in the CBC of those patients, the absence of anemia, which may suggest support in history of alcohol misuse. Most of these liver enzymes will be increased, but specifically the GGT is also increased, although it is not specific for alcohol, and will be elevated in the presence of hepatic steatosis and fibrosis, and the level may not therefore return to the normal with the absence of the chronic abstinence of chronic liver disease present, unexplained rib fractures, particularly bilateral on a chest X-ray, are also suggestive of alcohol misuse. The presence of jaundice suggests alcoholic hepatitis. determining the extent of liver damage often require a liver biopsy. طبعا بالنسبة للفراكشرز بها هواية أسباب. بالنسبة للواحد يسأل ليش يصير لهم chest X-ray have rib fractures bilateral. Usually this is because of the malnourished patients have abnormal level of vitamin D and calcium, which can lead to pathological fractures easily because of the osteoporosis, and the second because of their imbalance, and they may have repeated trauma from the repeated fall. Prothrombin time and bilirubin can be used to give something called the DF اللي هي discriminant function. Discriminant function كلش مهم اللي هو أيضا يسموه the Madri's score, which enable the clinician to assess the prognosis in patients with alcoholic hepatitis. I mean acute alcoholic hepatitis. هاي بيفد معادلة اللي هي تدور المعادلة هي ال PT في السيرم bilirubin in millimole divided على by 17 to compare to the milligram per deciliter عشان بالمليمول. ال DF إذا مختصر هو هاي المعادلة 4.6 في level of increasing the PT زائد البيليروبين level. هذين النقاط النقطة من هاي خلال هذا السكور المعين راح نقدر نعرف ايش قد الليفل اوف دي اف الغاية من الاكيوت هيباتيتس وليس الكرونيك. عندنا فد فاليو إذا طلعت 2 over 32 implies that the patients have severe liver diseases with a poor prognosis and with the one month mortality توصل إلى 45%. By contrast, patients less than 32 have a short-term survival rates of 90 to 80 100%. طبعا this also is an important indications to give a steroid in those people. Other important prognostic variables important in those patients with severe alcoholic hepatitis is the presence of hepatic encephalopathy and the hepatorenal syndrome. الهيباتورينال syndrome هنا when the patients they start to develop increasing level of urea and creatine after good rehydration and after excluding of the pre-renal causes of increased other pre-renal or renal or post-renal causes of increasing the that may increase getting abnormal function of the kidneys. طبعا يجي ال 1 month mortality تزداد by 50% for those with hepatic encephalopathy بينما دول اللي هم عندهم hepatorenal syndrome ال 1 month mortality توصل إلى 75%, which means that they have poorer prognosis than others. The most important point and the single most important treatment and that improve the prognostic factor is the cessation of alcohol. طبعا lifelong abstinence is the best advice. Generally the general health and the life expectancy are improved when this occurs, and this is unrelated to the stage of the liver disease. It's very important to know that abstinence from alcohol will have a preventive progression and hepatic decomposition and death. All these will be decreased when once the cirrhosis is present, but even if they stop the alcohol, with the presence of cirrhosis, all these points will improve because of the stopping the induction factors of the new inflammation of the liver. So the best advice is the lifelong abstinence and essential those who have more severe liver diseases. طبعا treatment of their complications of liver cirrhosis like the esophageal variceal bleeding, encephalopathy, and ascites may also needed. And good nutrition is very important, especially with the enteral feeding via the fine-bore NG tube in patients with severely ill. Corticosteroids mainly يعتمد على المادريز score. It's more than 32 have been very important to increase the survival. Septicemia and sepsis is the main side effect of the steroids. So, existing sepsis and variceal hemorrhage are the main contraindication to the use of steroid. And if the bilirubin has not fallen 7 days after starting steroids, they are unlikely to reduce the mortality and should be stopped. In severe alcoholic hepatitis, corticosteroids will improve the survival to 28 days by 65 up to 85%. إذا كان الستيرويد هو one of the contraindication مثل ما ذكرنا in patient severe septicemia أو severe renal impairment أيضا أو severe active variceal hemorrhage, we can use the pentoxifylline, which is a weak anti-TNF, have weak anti-TNF action, and may be beneficial in severe alcoholic hepatitis. It appears to reduce the incidence of hepatorenal failure, and its use is not complicated by sepsis. In severe alcoholic hepatitis, oral pentoxifylline reduces the patient's inpatient mortality, particularly from hepatorenal failure, from 46 to 25. And regarding the liver transplantation, the role of liver transplantation in the management of alcoholic liver disease remain controversial in many centers. However, alcoholic liver disease is a common indication for liver transplantation. But it's very important to know that many centers they have make assured that the patients have at least stopped the alcohol for 6 months with good behavioral changes, good behavioral lessons. So to do the liver transplantation. Otherwise, if the patients that have linked or addicted to the alcohol, they cannot benefit from even liver transplantation. طبعا the most important prognostic factor in this patient is the patient ability to stop the drinking alcohol مثل ما ذكرت, واللي general health and life expectancy will all improve when get stopped of drinking alcohol. طبعا الالكحول fatty liver disease has good prognosis بشكل عام, and the steatosis usually disappears after 3 months of abstinence. أما بالنسبة للالكحوليك hepatitis has significantly worse prognosis. About 1/3 of those patients will die due to acute episodes, particularly those who have hepatic encephalopathy or increasing prothrombin time طبعا to exclude the percutaneous liver biopsy. بالنسبة للcirrhosis, if not already present, will occur if drinking continue for sure, and patients with acute alcoholic hepatitis often deteriorates during the first 1 to 3 weeks in the hospitals. فلهذا يبقى الabstinence is very important to protect the liver from being changed to acute hepatitis or on the short term, and for the long term from the alcoholic liver cirrhosis. نجي على الموضوع الآخر اللي هو النون الكحوليك فاتي ليفر ديزيز اللي هو النافول. طبعا هذا الموضوع جدا أصبح شائع خاصة بالخمس إلى 7 سنوات الأخيرة لإنشافه هواية ناس ما يقدرون الأسباب بشكل مباشر للcause of chronic liver diseases. شافوا أنه عندهم some degree of steatosis or the fatty liver, and this will lead as a consequence of changes to liver cirrhosis without being the patient is symptomatic. طبعا الكاباثوفيزيولوجي هو يشبه الالكحوليك liver disease, but the history is very important that those patients are not consume alcohol. طبعا نقسم إلى الفاتي liver only just steatosis يسموه non-alcoholic fatty liver only. ممكن يكون steatosis مثل ما قلنا بالالكحوليك as a features of acute hepatitis with increased hepatocyte death, وستياتو يسموه steatohepatitis. non-alcoholic steatohepatitis, and ممكن be presented with the regenerative nodules and features of fibrosis, which means that the patients have cirrhosis. طبعا diagnosis of exclusion is very important, that we should exclude all the causes that may cause chronic liver disease or even acute insult. يلا نبدي نفكر بالنافولد و non-alcoholic fatty liver disease. طبعا الروبي بالنافولد اللي هو steatosis أو steatohepatitis, there will be variable increase in the level of liver function tests, especially the ALT, slightly more than the AST, but the reverse is true. Often the patients have overweight, diabetic, hyperlipidemic, non-specific features on the serology. Liver usually it's bright on ultrasound. And now there is a new entity of using the fibroscan or the levoscan, which is have a specific modality of detecting the level of the steatosis in such patients. Prognosis is probably good for steatosis, بينما الناش may lead to cirrhosis in minority of patients. والمشكلة إنه عادة دول asymptomatic، فلهذا يمكن أي واحد عنده مثلا obesity أو metabolic syndrome، عنده diabetes، عنده hypertension, thyroid diseases. All these should be checked that they may have increased level of enzymes with the increasing level of steatosis, which means that he is in the NASH state. مثل ما ذكرت في بداية الموضوع أنه ال features is very important to know that it's indistinguishable on the histological level from those with alcoholic. So the diagnosis of NASH may be depending on the whether the patients have alcohol misuse or not, and the absence of jaundice, and the presence of risk factors such as obesity and diabetes. عادة الجوندس عندهم أقل، عندهم comorbid features مع not alcoholic، عادة نمشي مع النافولد. بالنسبة للمانجمنت as a marker of a metabolic syndrome، طبعا identification of the NAFLD should prompt screening for and treatment of any cardiovascular risk factors. طبعا recognition is of a greater morbidity associated with the NASH as opposed to the simple steatosis, where liver targeted treatment should be focused particularly on the patients with those patients with NASH. بين قوسين يعني the patients اللي عندهم metabolic syndrome should be advised to have weight reduction, do regular exercises، انتبه على الميلز مالتهم، وأيضا يعني يجب أن يسوون good follow up regarding the hypertension, its poor control, the optimization for the control of diabetes and other comorbid conditions اللي هي بالتالي راح يتحسن من وضع الليفر. بالنسبة لهاي اللي ذكرناها قبل شوي هو النون فارماكولوجيكال. بالنسبة للفارماكولوجيكال تريتمنت صراحة ماكو لحد الآن دراجز يشتغل بشكل مباشر وحقيقي على ال patients with the NASH، بس اكو دراسات قليلة عن that patients who use vitamin E, metformin, statins and the pioglitazones have better prognosis than those not using these drugs. Once cirrhosis has occurred, طبعا survival is similar to any patients with the cirrhosis, like patient those with hepatitis C, 5 to 10 year 5 and 10 year survival توصل 90 بالنسبة لل 5، وبالنسبة لل 10 توصل إلى 84%. نجي هسه على موضوع جدا مهم اللي هو الأوتوإميون هيباتيتس. عادة هو من اسم أوتوإميون يعني related to the other certain autoantibodies that may affect the liver in certain way, usually middle-aged female women or teenage sometimes. عادة هم non-drinker without any background of viral hepatitis. They present with fatigue, arthralgia, myalgia, oligomenorrhea, jaundice, increased level of liver enzymes, with increasing level of gamma globulins, especially on the protein, on serum protein electrophoresis test. They have positive ANA, anti-nuclear antibodies, and or sometimes the anti-smooth muscle antibodies, and with anti-liver kidney microsome antibody. Interface hepatitis is with the lymphoplasmacytic infiltration can be found in the liver biopsy, and they typically respond to with steroid and immunomodulators.